Well, good afternoon. Today we would like to inform the citizens of Fort Wayne and Allen County of the preparation and readiness initiatives that the city and the county are currently putting into place in response to the coronavirus family, specifically COVID-19. First of all, the current suspensions and closures that we're experiencing here in the city of Fort Wayne and throughout Allen County are simply preventative measures, not government orders. Also, the social distancing recommendations are simply requests, not a government directive. Please be assured, though, that our team is monitoring the COVID-19 situation daily with Allen County Department of Health, with officials from Allen County, the City of New Haven, our state, and federal government to help ensure the safety of our community and the current residents who make up our community. We want all of our citizens to go about their daily lives, but be aware of their surroundings and interactions. Individuals and families should especially be vigilant when considering attending events that may end up being a larger group than normal. Additionally, they can protect themselves from respiratory illness with everyday preventative actions. Avoid close contact with people that you know are not feeling well. Avoid touching your eyes and your nose and your mouth after direct contact with someone. And by all means, wash your hands. Now, I know that sounds rather simplistic in nature, but you'd be surprised how valuable that becomes in the spreading of an illness. And wash them for at least 20 seconds. But above all, it's important that Fort Wayne and Allen County be prepared, but do not panic. Be aware, again, of your surroundings and your interactions. Now, businesses in our community need to be prepared as well. There will be some difficult situations that come about as a result of this virus. Our businesses should probably revisit their international travel policies and their out-of-state travel procedures as well. They need to take a look at the conferences and conventions that they themselves hold or that they send their employees to. Avoid large group meetings and take a look at public accessibility to your respective businesses. Additionally, I would like to suggest to all of our businesses that they look at flex time policies, video and teleconference possibilities, and, as I mentioned, an active hand washing and personal hygiene campaign. Finally, as a city our size, we obviously need to plan for worst-case scenarios on a regular basis. As a result, we will be following the guidelines and recommendations from the local health department and the state and federal experts and the authorities that we come in contact with on a regular basis. I'm also directing our public safety divisions, our water filtration plant operation, our water pollution control plant, our neighborhood code compliance, and our parks and recreation facilities, as well as our street department, to take a look at their operation, be leading examples by taking care of their surroundings and interactions in an appropriate fashion. Additionally, as the mayor of the city of Fort Wayne, I'm now restricting for the time being all business-related international travel and out-of-state travel for city employees. I'm also directing that our sick leave and short-term disability policies be examined and modified if necessary. Our office operating procedures and policies will be examined for flexible work hours and teleconferencing possibilities. And depending on the length of this pandemic, I will be examining our zoo park operations and adjusting schedules accordingly. Finally, Citizen Square will be reviewing our public policy meeting schedules and how they can be conducted in the future. In short, I have two specific recommendations for the citizens of Fort Wayne and Allen County. First, don't panic. We have faced these type of challenges before. We've been able to get through them safely, and we will again. Secondly, practice social distancing. It's been recommended that 6 feet be that distance. This will help out significantly. It will lower the curve as far as the exposure and help out all healthcare-related personnel as they address this pandemic. At this time, I'd like to ask our County Commissioner, Nelson Peters, to come forward. Commissioner?
Thanks, Mayor.
That's right.
Well, you know, Mayor really leads me a great segue into a couple of the things that I wanted to talk about. But I really first want to say thanks so much to Mindy Waldron, Dr. Deb McMahan behind me, and Erica Beecher from the Allen County Department of Health. They have worked tirelessly over the last weeks trying to help this community prepare for some of the things that other communities are now facing. The Allen County Board of Health deserves accolades for the hours that they're putting in. I had one member yesterday, as I was at the table, said, you know, when you appointed me, I had no idea what I was in for. And he's exactly right. You know, we are truly treading uncharted territory today. We've never been here before. And it is an evolving situation. So as we come out with policies and procedures and recommendations and listen to things from the CDC and others, we are really trying to hit a moving target. But I think the fact that we have so much community collaboration in Fort Wayne, Allen County bodes well for the collective approach that is being taken. This is a situation that's going to require an all-hands-on-deck solution. And I can see by the people behind me and the people in front of me that all hands are indeed on deck. We as county commissioners look at the issues facing this community and facing Allen County in a couple of different ways. We look at a 50,000-foot overview that talks about what should the community response be. How should we deal with the things in Allen County that we're going to be faced with potentially in the days ahead? Just to echo some of Mayor Henry's remarks, we need, I think, I don't want to call it strict adherence, but we need to pay attention to the CDC guidelines. They are there for a reason. So share the CDC website with your family, your employees, the people that you know. I know that the Allen County Department of Health has a website. Please get into that website for some logical tips on how to make yourselves, your families, and this community a lot healthier. The mayor mentioned social distancing. Absolutely essential in these circumstances. Companies are at a point now where they really ought to be invoking and reviewing their continuity of operations plans. Employee guidelines have to be reviewed by companies throughout Allen County to ensure the most appropriate response, one, to the employees, but two, to the various constituencies that they serve. If you're feeling symptoms, get the heck out. Don't come to work. Isolate yourself. If you've been exposed, quarantine yourself. Help us also shape the message on a more positive tone. Right now, we are in a situation that we've never been in before, but we are a strong, resilient county, and we've got the people here to bring us through this. And we will get out of this and be done with it sooner than later. Help convey that message. Help especially convey that message to our friends from the Department of Health, to those other folks who are on the front line, fire and police, because they're dealing and they're hearing these things every day. And I tell you what, in the state of mind that the national media and others tend to push on us, it's really hard to create any sort of optimistic outlook for the days ahead. But I'm here to tell you, we will together get through this. Do as much online business as you can, and I'm going to talk about government's initiative in just a minute. If you can do things from the comfort of your home, do them. We've talked about clicking for groceries and clicking for permits with the county and clicking here and clicking there to keep yourselves at home and out of harm's way. County government itself, in the days to come, will be looking at services to hopefully relax some of the deadlines and some of the rules that you're constrained with these days. We're going to look at perhaps amending some of our processes that will help make dealings with government about the last thing that should be on your mind. Now let me just take a quick travel through the 5,000-foot overviews. County government itself looks at several scenarios. We're going to stay open as long as we can. We're going to conduct business as normally as we can. If that doesn't work, we'll be open, but access may be somewhat limited to the services that you want and the services that we can provide at that time. The third approach is we got to close the doors, but in that case, emergency personnel will still be in the forefront of creating a safer and healthier community for all of us. So take those morsels with you, pay attention to what's going on, make sure you know your surroundings, check with the Department of Health pages, the CDC web pages, and together, folks, we're going to get out of this sooner than later, and we're going to come back even a healthier community. Thanks. Mayor McMichael from New Haven.
Good afternoon, everyone. The City of New Haven has been preparing and planning for the last 3 weeks. We'd like to thank our partners with the City of Fort Wayne and Allen County and the State Board of Health as well. We have restricted travel for our employees, both inside and outside of the state of Indiana. We also are restricting the number of meetings. But rest assured, our essential services, water supply, public safety will continue. We have a continuity of government plan in place that we are continuing to update as this situation changes seemingly by the hour. But your city will be there for you, whether it's the city of Fort Wayne or the other communities of Allen County. So be mindful of your surroundings, and if you kind of get that feeling in the back of your head that maybe you shouldn't be in that crowd, maybe that's a good idea. We're also asking people to utilize our website for things like bill payment, if at all possible, and also to use the utility drop box in our parking lot to make your utility payments. Many of the services that weren't available in the past are now available online, and we recommend that you make a phone call to City Hall at 748-7000 to ask those questions. Perhaps it can save you a trip into the city. I'd like to thank our partners at the City of Fort Wayne, Mayor Henry, the commissioners, the Allen County Board of Health, and everybody else that's working extremely hard to keep the community safe and keep the community moving forward and doing business as much as usual. So thank you. I'd like to introduce Dr. McMahan.
All right. Actually, I've been seeing you media folks so often, I think I'm going to have to put you on my Christmas gift list. I don't know, but it's hard to believe that it was 2 weeks ago today that we were looking at what was going on globally and thought, you know what? This isn't going the way we want it, and you cannot believe how much activity has been happening at the collaborative community level through businesses, government, teachers, schools, faith community, mental health, all of that healthcare. You can't imagine how much collaborative work is. Lee, you've been there. You've seen how much collaborative work has been going on in 2 weeks. It's unbelievable. So first of all, I want to thank all of those people for all of the time and thought and deliberative process that they've been willing to put into this. But I also want to thank the media. I have been very pleased with the tone that you guys are taking. You're really reporting this responsibly. I don't know how anybody could see what you guys are doing locally and become panicked or fearful. You have done a very good job at having a very measured and thoughtful approach during, as what Commissioner Peters robbed my thunder, uncharted territory. So again, thank you guys for what you're doing. What I want to do today is, though, set the stage and make sure, again, that we are all on the same page, understanding this is evolving, things are changing, and this is an overused word, but it is a fluid situation. As you all know, on March 11th, the World Health Organization determined that COVID-19 was now officially a pandemic. What that means is it's met those 3 criteria. A novel virus, it can infect, so nobody in the world except maybe 5 million people have immunity to it. So you have 7.7 billion people susceptible to this virus. It can make people sick, the severity of which is under determination, but right now it looks like it's a little more, behaving like the SARS virus, where it can make older people sick and have a prolonged recovery and go into something called ARDS. Young children seem to be spared this, unlike H1N1, but that's fluid and could change as we get more testing. And third, and when they define it and call it a pandemic, what that means is they have now determined and say confidently that this can spread easily from person to person. That's what makes this a pandemic, okay? Now that not only do we have all these people susceptible, they can become ill, but now we know once it comes in a community, we have 370,000 people who are vulnerable, and it will probably spread very easily. This is not H1N1. All of us have been, I think most of you are old enough to have been through the H1N1 pandemic, even in a professional capacity. This ain't that, okay? This is very different. There is no vaccine. There's no treatment. The only tools we really have are what everybody's been saying here is social distancing. And why is that important? Our immediate goal for this community is to keep our healthcare systems open. If our healthcare fails, we're in trouble because they're busy every day seeing heart attacks and strokes and babies and cancer and this and that on top of respiratory syncytial virus and influenza and now this. That must be our primary goal, is to keep healthcare going. So how do we do that? What we do is stagger transmission. Our goal is we're not going to prevent COVID from coming through Allen County. It's going to, but what we want to do is stagger it over time. If we can have waves of transmission, we can decrease the number of people who are sick enough that they have to go to the healthcare system. They have to go to their doctor's office. They have to go to the ER. If we can stagger that, we can keep things up and running. Because remember, if everybody gets sick at once, that's a lot of healthcare workers too, right? That's a respiratory therapist, that's nurses, it's MAs. They get sick too, and then they can't serve the people even for non-COVID related things. So our primary goal has to be to help keep healthcare open. So to that end, we need to do everything we can to limit transmission in our community and do it again so in a way, so we're not going to prevent it, but do it in a staggered way. We want to limit all unnecessary person-to-person contact for more than 5 minutes. If you don't have to you don't have to have a knitting club, a quilt club, a this club, you don't have to do that. For right now, we're saying stay at home, talk on the phone, talk through Skype, Facebook, all those sorts of things. As Commissioner Peters said, use takeout, use delivery, have Walmart deliver to your door. That's the way we would prefer. Limit your human-to-human contact, if you can, as much as possible, for the next few weeks at least, maybe a month. Realize that at some point more aggressive measures may need to be taken. There may be school closings, there may be business closings. We are in a serious pandemic. It doesn't mean we want to be panicked or frightened, but we need to do what we need to do. Understand that the delivery of services, as everyone, the mayor and the commissioners and the mayor of New Haven have said, things may look differently. That's just the way it is, right? We have to do this to be able to get through this on the other end of this. Remember, this isn't a tornado where we all hunker down for 6 hours in the basement and, oh boy, thank God that's over, and now we go out and do the prolonged recovery phase. No, the threat phase is weeks to months. It will take weeks to months for this to go through our community, so we can't just hunker down. We need to be level-headed and do what we can do to minimize our risk of acquiring this infection. And then if we do become infected, we need to do the right thing and use resources responsibly. That doesn't mean I go to the ER with a sore throat. We need to keep the ERs open for people that are sick, maybe chest pain, shortness of breath, heart attacks, those trauma, motor vehicle accidents, those kind of things. We need to keep the ERs. You need to call your family doctor. If you have a temperature of more than 100.4 and a cough, call your family doctor. If you go to our website or to your doctor or your healthcare organization's website, they have a specific number they want you to call to be able to modify, and then the disposition will be from there. You need to understand right now, and this may change in the next week or so, but testing is very limited. That's why we don't have a lot of cases, because we don't have a lot of testing done. And that's because this has only been around for 10 weeks. This is they have to develop a brand new test, and that takes time with viruses. It's a very complicated process. So right now, only really sick people are getting tested. We hope that's going to improve later, but remember, testing is really only valid if you're sick. You don't want to go and say, hey, have I been exposed to COVID? That's of no use. Your doctor will make the determination if and when commercial test is readily available. They will make the decision who should get that testing, so as to prevent false negatives, false positives, those sorts of things. As he said, I wish I could make this not so simplistic or a little more sexy, but tried and true things: washing your hands, cover your cough when you sneeze, stop shaking hands. You can do this, or even, you know what, I don't even think we should do that if we're coughing and sneezing into it. Now that I think about it, let's just do this, okay? Don't go to work or school with a fever. They'll make it without you. I trust and believe people can make it without your presence for a few days. Avoid unnecessary travel. Think now about spring break, kids. It's here. The pandemic has been declared. It's here. It's a serious virus for which you have no treatment or vaccine. Maybe spring break is something where we just stay home and play Monopoly and get to know our kids again, right? Let's think about that. And then this is the time to get every vaccine you can get. If you have diabetes, you should have both pneumonia vaccines, you should have the pertussis vaccine, you should have the flu vaccine. Get every vaccine you can get, right, to make sure that you don't get other. The reason I say that is because if you get sick with flu, and then you finally recover, it takes a while, and then 2 weeks later you get exposed to COVID, your immune system's compromised. It's going to be really hard for you to recover. So it's really important that you protect yourself from everything you can, so that when you are exposed to that, you have a milder course. So just keep that in mind. That's why I'm saying that. So again, that's what we're doing here locally, a lot of planning. What we want you to understand is, number one, the goal is to keep healthcare open, keep other critical infrastructure going, although it may look different. It's really important to do that. You need to do your part. Yes, you may survive, but you may give it to somebody who won't. So this is the time not to think about yourself. It's just time to think about the community, all right? Behave with integrity. If you have to wait an hour and a half, I don't want you yelling at people, because then you know what we know from SARS, they don't show up. You yell at a healthcare worker because you had to take an hour and a half to get into the exam room, they don't come back. And furthermore, many of them leave the profession. You need them there, and I don't care whether they're putting you in an exam room or giving you a fish sandwich. The last thing I want you to say to people when someone's provided a service to you during this pandemic, thanks for showing up. Thanks for showing up. I think that would be a wonderful tagline for Allen County. Thanks for showing up. Thank you for showing up today, by the way. The governor made some really very thoughtful, I think really good recommendations. I'm not going to go over them now, but you can go on his website. I think he made some really thoughtful ones that we will abide by and encourage, and I look for those to change and evolve over time. Do what you can do. So as everyone up here said, we can get through this. It's not going to be fun, but at the end of the day, we want to look back at how we behaved with integrity, that we made evidence-based decisions that were for the greater good, and we conducted ourselves with integrity during this. We want to be able to look back on that. And with that, I'm done.
Thank you, Doctor. At the end of the day, it's simply use common sense and minimize your risks. This will take a while to get through our system, to get through our population. As Dr. McMahan said, it may take several weeks or several months, but we're going to get through this. It's just a matter of working together, working united. And I particularly want to thank not only the individuals who spoke today, but all the ones standing behind us, and many of you out there for the work that you've done so far, and again, minimizing the community's risk. So with that, that ends the formal press conference. Obviously, we'll be available for further questions. So thank you again for coming.
Are there specific plans for people who have to be out, like fire and police? Are there specific plans for them?
Well, obviously, we've talked to both the police chief and fire chief. They understand their responsibility, and it is to protect our public. And they also take an oath that if they have to put themselves in harm's way in order to accomplish that task, they will.
And how are maybe police officers prepared to handle quarantines if they have to enforce them at some point for people?
Well, right now, there is not a mandated quarantine of any type. Again, it's voluntary, as many of us said already, that if you feel ill, if you think that you have the symptoms related to COVID-19, stay home. Call your doctor and let him or her decide what the best action is. Don't go to the hospital directly. Go home and call your doctor. That's the best course of action.
If it got to the point that we had to have a citywide or countywide shutdown, is that a decision that you would make, or it comes from the health department? Or?
It would come from the county commissioners and myself. Again, thank you all very much.
I wanted to say, I forgot one thing.
Oh, forgot one thing.
It's very important. We, all of us here, and a lot of other people in the community, business owners, philanthropy, everybody understands the potential economic impact this would have on our community. It's how do we plan for that? How do we plan for people who are living paycheck to paycheck or who are using childcare and then won't be able to go to work if the schools close? To that end, our local philanthropy, our St. Joe Community Health Foundation and other foundations have partnered with the Miro Center, and what they have done is made available a survey. It's on our website that people can take so that we can take that information and have an idea of what are going to be the community's needs during this potential during this pandemic. I would really encourage people, if you could put a link on your website for people to go and be able to take that survey, that will be so helpful in terms of planning. How do we come alongside the community in ways that we may not know and ways that are going to look different? Again, uncharted territory. How can we come alongside people? But we need to know the scope, and we need to know what are the particular issues people might have. So please direct people to that website for that survey. We'll be monitoring that daily, and that will be very helpful in future planning discussions. Thank you for that.
Thank you, Doctor, and again, thank you all for coming today. Thank you all.